Look at all these veggies. I'm in for a ride. I'm actually excited because I'll be healthy. What you see in front of you is the best caregiver in the world called Rachel. Huh? Look at all this food. The Mediterranean diet. Huh? All these berries and fruits and vegetables have been washed. I even have things like, what do I have here? Sauerkraut, capers, fermented foods, so dried, sun-dried tomatoes, jalapeno, pepper juice. So there's blackberries, blueberries, kumquats, coriander, potatoes, strawberries, ginger, sweet potato, orange. You've had the tests and you've received a positive diagnosis. What happens next? Introducing Multidisciplinary Meetings, or MDMs. These are collaborative gatherings where a diverse team of healthcare professionals comes together to discuss your case and create a personalized treatment plan just for you. Think of them as the A-team. MDMs in oncology are essential for providing high-quality, coordinated care for cancer patients. Think of them as the ultimate team where various healthcare professionals unite to tackle cancer cases, where superheroes gather to battle cancer without the spandex, of course. What is the purpose of these multidisciplinary meetings? Well, there's comprehensive care. MDMs cover it all. They make sure every aspect of the patient's treatment is considered: surgery, chemotherapy, radiation, and supportive care. Think of it as a buffet for cancer care where no one leaves hungry. Then comes collaboration. The MDMs foster communication among specialists. Those are oncologists, surgeons, radiologists, pathologists, and nurses. They consider personalized treatment plans. MDMs help develop individualized treatment plans based on the latest evidence and clinical guidelines. There is no cookie-cutter approach here. This isn't a baking competition. Everyone gets their own unique recipe for success. Who are these typical participants? Well, we have oncologists, medical and surgical oncologists who lead the discussion on treatment options. There's the radiologists. They provide insights on imaging studies and their implications for treatment. We then have pathologists. They offer expertise on tumor biology and pathology reports. And of course, the nurses. They contribute perspectives on patient care, management of side effects, and support. Other specialists may include cardiologists, nutritionists, social workers, survivorship doctors, caregivers, and palliative care providers. The structure of MDMs include case presentations. Each case is typically presented by the responsible oncologist, highlighting key details such as diagnosis, staging, and previous treatments. Then comes discussion time. Team members discuss the case, propose treatment options, and consider the patient's preferences and overall health. When all is done, a decision needs to be made. So a consensus is reached on the optimal treatment plan, which is then communicated to the patient. Benefits of these MDMs. Studies have shown that MDMs can lead to better treatment decisions and improved patient outcomes. There is also enhanced learning where the team members learn from each other, like a masterclass in oncology, where knowledge is power. MDMs are patient-centered and deliver patient-centered care. So patients' needs are front and center. They are the real stars of the show. By leveraging the expertise of a diverse team, these multidisciplinary meetings aim to optimize treatment outcomes and enhance the overall patient experience. Good morning. Here we are getting ready to go to the oncologist cardiologist. And there he'll check he'll check on what type of chemo and immunotherapy is best with my blood pressure. And yeah, so it's a consult, and we'll let you know how it goes. We're here about to see the cardiologist, and yeah, so we're at the East Wing. East Wing? Yep.
The doctor's office, the cardiologist.
I'm going live though. I'm going to make this viral, my journey. So yeah. This is not a joke, right?
Because of your weight, the amount of chemo that you get is calculated according to your body surface area. So that just increases the risk that it may affect the heart. Okay.
Remember.
How are you feeling?
I'm out of breath and I need to pee. But otherwise, I'm really happy because the doc says everything looks good and I'm pretty healthy for someone who's been on blood pressure meds for 8 years. So let's keep it going.
Definitely.
Really happy.
Leaving the hospital now.
Leaving the hospital.
Not for you.
So we'll see. Yeah, I'm very scared. I won't lie. I'm scared because I read some of the side effects. I read about some of the side effects, and already my mind is like, I've got all the side effects. I've got all the side effects of this chemo. But I believe in God, and I know that He'll get me through it. And my support system has been fantastic. Speaking of support system, my older brother has just popped into town, Joburg. He's gonna come with me to the appointment together with my sister Rachel. Yeah, and we'll ask the doctor all the questions that we need to ask. Yeah, so it's good. It's good. I'm feeling happy, positive, and yeah, let's do this. Let's start. So I'm here with my big brother, Mr. Chisha, and my sister Rachel, and we are on our way to see the doctor, the oncologist, who's gonna tell us about the treatment plan. So how do you guys feel?
Anxious. Let's hope it's good news.
I'm anxious too.
Are you excited a little bit? Because it's been a minute, right?
It has, and also that the news is generally very positive. So it's all good, at least.
So
In the best place possible.
yeah. So we'll catch you later. The last few days of exercise, doctor said I'm not allowed to get my heart rate to over 100. So Rachel's torturing me, walking on these hills. Whew. It is not easy, but it's gotta be done. This I will not miss. You're torturing me.
Yeah.
If you have a look at the hills, they are alive. Yeah. Okay, went walking. I'm tired. I'm done. The hills of Joburg are not your friends. Yeah, we went walking for about 30 minutes, uphill and downhill, and then we were doing speed walking. Yeah, so just trying to get the exercise in. Today I am going to meet my survivorship doctor. So survivorship is all about the well-being of a cancer patient, from diagnosis to basically treatment and beyond. She will be with me throughout my journey, and then yeah, so we'll see what happens. Yeah, so basically she makes sure that my diet is okay, my mental well-being is okay. She does life coaching, and she basically gives me advice. She's like my partner during the whole journey. So I'm excited to see her later on. Yeah, so that's my day planned for today. Just having a spot of lunch with my family before I go to the survivorship doctor. Yeah, so looking forward to the doctor. I'm with my older brother.
Yeah.
My oldest brother, and my oldest friend, Abby, and my sister, Rachel. So, yeah. We'll update on what comes out of this meeting. Well, we just had our session with Dr. Hart, who is the survivorship doctor. Is that what you call it?
Yes.
And she was great. She actually is going to be with me from beginning to end, and she's going to help me towards the end of the treatment get back to my life, like help with life coaching, and she was really, really good, and we really, really enjoyed her. What did you think?
Yeah, no, she was great. You know, and she's going to help with diet and how you're feeling during and after. So she's very, very helpful. It's fantastic. Yeah.
And she just told us what food to eat and what food not to eat, and how to prepare food, and basically just
avoid processed foods.
Yeah, avoid processed food. Oh gosh. Oh, there we go. Avoid processed food, and even things like mayonnaise and the condiments as well, make sure that they're not, and then she talked about the rainbow for both vegetables and fruit, which is all colors of fruits, from red to the whole rainbow, the spectrum. And then also she talked about blending or smoothies being better than juicing, because juicing removes all the fiber, and that fiber is the one that fights the diseases. So
she meant have smoothies, because smoothies are a bit because they digest slowly, then because of the fiber. But juices go straight to your liver. So which will be when you're sick and not feeling too good, and your immune system is low, they go straight to your liver. So they'll be too hard on you.
Yeah. And then obviously the oils, she said stay away from the
all seed oils.
Seed oils, but go for more like avocado oil. Grapeseed oil is good. Coconut oil and olive oil. Yeah. So now we're learning a lot, yeah. And then things like, because my type of cancer, is triple negative, it's not hormonal, so I can eat foods that can go with hormonal cancer. Like say if I had the hormonal cancer, which is HER2, I wouldn't be able to eat soy. Yeah. So she was just like, that's the reason why we need to know what type of cancer you have, so that we know what food you can eat that don't go against your healing.
So she can eat all good proteins.
Yeah. and I have to eat proteins because
Lots of
proteins
protein.
in the morning, evening, and lunch, 3 times.
So she can have her T-bone, people.
Twice
Twice
a
a
week. Yeah, because everyone says no red meat, no, but she said I can have red meat. In fact, I need all the proteins, and it can be proteins in vegetables, so that's also legumes like beans, lentils, things like that, and protein in meat as well, so that's tuna, wild fish, chicken, red meat, as we said. Yeah, so basically, yeah, so it's looking good. Thank God we went shopping and we bought the right thing, because
Yeah,
we
we
were
did.
working with the Mediterranean diet anyway, because Prof. Ben told us about Mediterranean diet being the best. So yeah, so
So it's good.
yeah, it's good.
It's good.
We're getting there. We're getting there.
I mean, as I'm supporting, I feel very, very positive, and I feel relieved because I know there's somebody else that is going to, help me too, supporting her. This is unknown. We don't know how she will respond to the chemo, so it's nice to know that you can call somebody who knows these things, and they help you help her.
Yeah, and Dr. Hart kept saying, "I'm here for you too," to her as her support, which is really, really nice, because
Yes.
remember, she also needs the support, right? Because it's both our journey,
Yeah.
me and my sister here. Yeah, so no,
She's carrying the cancer. I mean, you should hear her talk when she's talking to these people. She's saying, we.
Yeah.
So really, we're in it together. She's just carrying the cancer. And
Exactly.
She's gonna go through the treatment.
But then you're the one who's going to help me,
Yeah.
obviously, when I'm down.
Yeah.
So I have
She
to kind of
cries.
rely.
When she cries, I listen and I go and cry by myself.
No,
Or
but
I
you're not
call.
supposed to cry. You're supposed to call her. You're
Yeah,
supposed to
I
call
call-
Dr. Hart.
Yes.
Yeah, so that's what survivorship is. So it's basically the psychology behind and making sure that you are fine emotionally and physically.
Yes.
Yeah. So we'll keep you posted tomorrow.
Hanging busy. Just wanted to give you a word of encouragement. I know this journey that you're starting on is going to be a very tough one, but you are one of the toughest girls that I know. And if anyone can fight with this diagnosis, you are definitely that girl. So I just want to wish you all the best on this journey. And I'm just going to be here standing right by your side every step of the way. And yeah, you're a fighter. You are 100% a fighter. And I'm going to be walking with you in this journey right by your side. Love you.